Hey everyone, welcome back to my channel. Thank you so much for sticking it out with me and being patient with me, waiting for me to post. I'm sure you haven't been sitting there waiting for me to post, but I have been so sick. I actually did post a pregnancy update. I am currently 20, tomorrow will be 23 weeks. I didn't post a pregnancy, I filmed an update. And I was going to post it, but the audio wasn't there, so it would have just been me mouthing nonsense. So I'm going to try, and I tested this. Hopefully everything's working the way it should be. But I have my phone here with different notes, and I'm just going to share with you guys what's going on. Let me preface this video by saying, first of all, that this particular pregnancy has been my most difficult. And this is my 6th child. My kids are 5, 4, 3, 2, 9.5 months. They're really, really close together. I am having, this will be the 6th child in 6 years. So I don't think that has anything to do with it. Like my first pregnancy was my second hardest, but this one is definitely the most difficult so far. Anyway, if you're coming to this video looking to see, like, comparing your pregnancy or how it might be for you at 23 weeks, you know, just all I'm sharing is what's going on with me. Don't take this as what's going to happen with you, like, especially if this is your first child. I don't want to scare anyone, so I'm just going to share what's going on, my experience with pregnancy number, this is actually pregnancy number 7, baby number 6. So this pregnancy is very high risk. That's what they told me, very high risk. So they did some kind of testing, so I have a high chance of preeclampsia, and I'm actually seeing 3 different doctors just for my pregnancy, and now I think just this month alone I will be seeing 7 doctors, because now I have some other issues going on. This is not pregnancy related as far as I know, but I have something going on with my throat. I have swollen lymph nodes. Apparently may have something going on with my heart that's causing me to black out. I've had this problem pregnancy and non-pregnancy, so I don't think it's related at all, but they may have been able to pinpoint a little bit more what it is, but I have to see a cardiologist, get an ultrasound done on my heart, and it might be something with an artery. So now I'm seeing a cardiologist. I wrote it down here because it's hard for me to remember everything. So cardiologist, radiologist, ENT, and a hematologist, my primary care doctor. But for pregnancy, I am seeing the OBGYN and the maternal fetal medicine. They do my ultrasounds because I'm high risk. And who else do I see? Well, the hematologist, yeah, is also. Technically for the pregnancy, I am on blood thinner because I had a pulmonary embolism after my last C-section last year. So they have me on Lovenox, blood thinner, and I do 2 injections a day. And I don't know when, but at some point they're going to probably switch me to some kind of heparin. I don't know the exact name for it. And that will be 3 doses a day. So I don't know at what point that's going to happen, but I am also apparently at high risk for having the baby early. That happened to me twice, the first 2 pregnancies, and then I never made it to 40 weeks. The next 3 pregnancies or births were C-section, and they were done around 39 weeks or a little after. So nausea, as far as symptoms I'm having right now, nausea, like the morning sickness, I still have that really bad. So that is actually, and I didn't even write this down. Nausea is probably the worst. Well, heartburn might be the worst. I don't know. Nausea, heartburn, and exhaustion. I am so tired, but also I have, I get winded really easily when I'm pregnant. So there have been times, I know I see this with lots of women, they even just talking, like sitting and talking, they could just get so out of breath. And that happens to me, but also, like, if we could hardly go on any, like, trips or anything right now, or I get nauseous in the car. If we go, we went to Cabela's, I don't know if you know what that is, but an outdoor store, and just walking around, I had to wind up using the electric motorized, whatever that is, wheelchair thing. And yeah, I definitely needed it. I could barely stand, and I kept trying to lean on everything, and I couldn't breathe. It was so bad, but those symptoms are pretty strong sometimes. Let's see. And also, I have lost weight this pregnancy. I haven't gained anything yet. So over halfway through, I am down about 10 pounds still. I've been down 10 pounds for a while, and it just kind of staying there, I guess. So that's actually good for me. Normally, it probably wouldn't be the best, but because I started out overweight in the first place, it's perfectly fine, according to my doctors. So anyway, in this particular pregnancy, I have the baby's placenta is in the front. So that means I don't feel her as easily or as quickly as I maybe would with the other kids. Even though my last baby, her placenta was also in the front, this one's just a little bit different. So I very rarely feel her. Every once in a while, a kick here, a kick there, and it's not that frequent and it's not that strong. But whenever we get ultrasounds, I can see her moving quite a bit on the screen. So I also found out, I went for my 20-week anatomy scan, and I found out that there are a couple of, so I'm sorry, I have the kids playing around me. I wanted to do this during their nap time, but it just wasn't going to work out today. So I'm doing what I can, working with what I have. I wanted to tell you guys about the anatomy scan. I had around 21 weeks, and they found on the baby's kidney, one of her kidneys. By the way, if you missed my gender reveal, I did do that. I think that was actually the last video I had posted on my channel, so go check that out. I'll try to leave a link below if I think of it, or up above or somewhere. So the baby is a girl. Spoiler, but I've already been saying girl, she, all that stuff. So, here, what's wrong? Anyway, at the anatomy scan, they found that one of her kidneys has an extra, I don't know what to call it. I forget what he said, like ventricle or whatever. You're probably gonna laugh at me. I don't know. It's an extra thing. Man, I wish I could remember what it's called. It has an extra one, which he said is not a concern at all. So I was very happy about that. The only reason it would be something that's good to know is if, like, later in life she needed surgery or something done for whatever reason with her kidneys, it's just good to know. So that's good. At least it's not going to affect her in any way. They also found that there was something going on with the placenta. So it's like a growth or something like hanging off. And the doctor wasn't sure if it was placenta lakes, I think it's called, or a blood clot. So I am on like the blood thinner, Lovenox, like I said, but they're not sure if that would have caused it or not. But they said with placenta lakes, it should get smaller or go away, I think. And then with a blood clot, I think it would stay the same. Maybe either way, it's like a blood-filled sac or growth on it or whatever. So I had to go back 2 weeks later, which was actually I went yesterday. That was the following 2 weeks to see if it had grown, to see what's going on with it. And the doctor did confirm, it was a different doctor this time, he confirmed that it is a blood clot for sure, and that it should stay the same. He said it's possible that it could leak into the amniotic fluid, and so I was concerned. I said, wouldn't the baby swallow that? And he said that would be okay. It would actually help her iron probably, and he said it would be a good thing. Almost like it would be fine. So I'm not concerned about that. Thankfully, that's nothing to worry about. But he did say there are risks, I guess, with having the blood clot there early, like preterm labor, which I'm already at risk for. So that's a little bit scary. That's very scary because basically, if I would go into labor before, like on the medication I'm on now, it's a 12-hour dose. So I would need to stop it 12 hours before a C-section. And I should have a scheduled C-section, but they're not sure if they're taking the baby 37 weeks or 39 weeks. They don't know yet because of all the things I have going on. They might do it earlier. I love you too, baby. So that's all up in the air still. And basically, if I would go into labor, like after I take a dose of this Lovenox, it would be very dangerous for me because I can't have the baby vaginally. I would have to have a C-section, and I would bleed. It's not funny, but you know, I would bleed too much. It wouldn't be good because I'd be on blood thinner, obviously. And I already have my hemoglobin, or whatever it is, the iron levels, if you're into the medical stuff. I think it's at around a 10 right now. So the normal range is 11.5 to whatever, 15 or something. And when I went into labor with my last child, it was at a 9. By the time the C-section was over with, it was at 7.1, and I did wind up needing blood thinner, so I needed a transfusion, and we want to avoid that this time. So, of course, I wanted to avoid it in the first place. There's a speck of dust. Anyway, so I am really, really hoping that doesn't have to happen. My hemoglobin, or whatever, the iron level thing, is slowly dropping. My absorption is not good. None of it is good. I'm not even taking a prenatal right now because it makes me so incredibly sick. And the hematologist wanted me to go get IV iron like 2 to 3 times a week, which would be impossible for me. There's no way I can go in that often. I have so many things going on, and I have 5 kids at home. I have no one to watch the kids, and my husband works, and it would just be a lot. So I couldn't. It's not possible. So I'm trying to figure out how I could get that prenatal in and get my iron up. It's very important. But like I was saying about preterm labor, if I would go into labor, like with my second, so my first and my second, they came before 37 weeks. It was 36 and however many days with both of them. Spontaneously, my water broke, and it was pretty scary at first. I did not expect that at all, but it went fine because obviously I wasn't on blood thinner. There was nothing like that going on. The babies were born vaginally, but the second one was born within like 7 hours and 15 or 7 hours and 10 minutes or 20, something like that. A little over 7 hours from the time my water broke, unexpectedly. Like, I was perfectly fine, minding my own business. I was actually going to sleep for the night, and my husband had just taken a Benadryl, and my water broke, and she was born a little over 7 hours later. Now, if that would happen and I'm on Lovenox, that's obviously 7 hours is not good. I also should probably, they're going to switch my medications because the heparin is reversible, I guess, whereas the Lovenox, I guess, is not. So, so many things. There's so many things to think about. So many dangers and risks right now, which is why I'm leaning toward getting my tubes tied during surgery with this baby. And I would be content with that. You know, 6 kids, I think that's a very full family, full life, family of 8. It's a pretty big family. So we are so happy with that. But it's obviously, there's a lot to think about with something like that, with getting my tubes tied. I love you too. Sorry, Hattie's hair is a bit of a mess. Her hair is always a mess. Right, Hattie? Yeah, it doesn't matter how much I brush it, so. Anyway, also the first, like at my anatomy scan, the baby was low down and her head was like right at my cervix, and I was getting concerned about that, but then she wound up being breached. So yesterday she was breached, so that made me happy, I guess, even though it's like, you know, it shouldn't make me happy, but like it's a C-section anyway. I love you too. But yeah, now I just have to do my appointments with radiology, cardiology, ENT, all of that, and I think that's all I really have to update on what's going on with the pregnancy. That was a lot because I have not been on in so long, so I do apologize. And I have videos coming up of, I think I'm going to do another pregnancy update at some point, but that's not going to be the next one. The next one, I forget. I would love to do a baby names video at some point, but I don't want everything to be baby related. I am going to probably do postpartum freezer meals because that's something I really, really, really just need to do anyway. But right now we have a fruit fly problem in our house, so we have to take care of that before I would like do a big bunch of meals. I did one meal last night when I made dinner. I did an extra one for the freezer, and I had my husband stand there and watch to make sure no flies flew in. This is very important to me. So anyway, a fly did get in my pork chops, so I had to clean the whole thing out, and it was just a mess. Anyway, so I need to get rid of these flies. They are driving me crazy. That is a totally different topic. Anyway, thank you. If you have stuck around this long, thank you so much. And for listening to me blather on. And if you're not subscribed, please do that. I would appreciate it so much. I absolutely love interacting with you guys in the comments. So if you wanted to go ahead and leave a comment, I would love that. Doesn't have to be pregnancy related. Just friendly hello, anything. I try to respond as best as I can, but I should. It's just maybe not right away. Hopefully. But I really do love interacting with you guys, and I appreciate all the feedback I get. I appreciate the support you give me on my channel. So thank you for that, and I guess I shall close this now, and I will see you guys in the next video. Bye. Just kidding. I wanted to add something real quick. For those of you who are not aware, my Instagram had been hacked a while back, and I just want to keep mentioning this. If you are not following me there, I'll try to leave my handle there if you want to. I haven't been posting much lately because things have just been crazy and not feeling well and everything, but yeah, I have a new one. Just want to make everyone aware. So thank you again, and I will see you later. Bye.